Cystic fibrosis is a genetic disorder that affects approximately 75,000 patients across the globe, roughly equally split between the US and the European Union. There are certainly high levels of CF in Canada and Australia as well. And this genetic defect results in infection in organ systems, primarily the lungs of cystic fibrosis patients. And as a consequence of the infection in cystic fibrosis, particularly in the lungs, the immune system goes into overdrive. And that immune system becomes less discriminate in what it attacks. It begins to attack the healthy lung structure, not just the bacteria. And the beauty of the Celtaxsys anti-inflammatory portfolio is by adding aspilostat on top of a patient's current standard of care, we can modulate their immune system down a bit without ever turning it off and reduce the damage that's associated with an overheated immune response in cystic fibrosis. I think it's important to note that care for cystic fibrosis patients has risen over the last decade, and that's a good fact. But the sad fact remains patients who are diagnosed with cystic fibrosis often expire between their 35th and their 40th birthday. And the primary reason for that early expiry is due to inflammation. Overheated inflammation begins to damage organ systems, primarily the lungs, and patients over time with decreased lung capacity often require lung transplant. And as a consequence, there's more to do today. While the current therapeutic regimen in cystic fibrosis addresses things like infection and pancreatic insufficiency, and even we've seen some terrific progress in CFTR modulation, which is getting to the ultimate gene defect that's the hallmark of cystic fibrosis, the sad fact is there's not an anti-inflammatory that can be added on to patient standard of care that will help reduce the damage that's associated with overheated inflammation. And that's the beauty of the aspilostat CF program. It's a simple once daily capsule that can be added onto a patient's existing regimen that will dial back that overheated immune response, get patients back to a more normalized response without increasing risk of patients having infection because of too much immunosuppression. In our recently completed phase 2 trial, we've actually been able to show that aspilostat can reduce inflammation and actually reduces the number of pulmonary exacerbations. These are bad clinical outcomes that often require hospitalization for CF patients because they need rescue medications because their lungs cannot function properly. Aspilostat's been able to show a significant reduction in the number of exacerbations that patients with cystic fibrosis have over the course of a year's worth of therapy. And that's a very, very important outcome because each exacerbation results in permanent lung damage to patients. That irreversible lung damage is the unfortunate consequence of a pulmonary exacerbation, and what has Celtaxsys very excited and the CF community at large very excited is that by reducing pulmonary exacerbations, we could potentially reduce permanent lung damage, prolong lung life, and potentially even prolong life for patients with cystic fibrosis.